SWOG S1310 study was a randomized phase 2 study of comparing a MEK inhibitor versus standard therapy of 5-FU or capecitabine. So in the past, there were small phase 1 studies showing that MEK inhibitors as a single agent had activity in advanced cholangiocarcinoma or bile duct tumors with response rate anywhere from 10 to 50% and also seeing some complete response. So based on the hypothesis, we decided to conduct a study in advanced biliary tract tumor with patients who are refractory to at least to one line of therapy, where the patients were randomized to either a MEK inhibitor or to a capecitabine or 5-FU. When the trial was conducted, actually, this was the first sort of randomized study in refractory setting. Right now, there is obviously ABC study that was presented last year, which is a larger study in refractory setting comparing FOLFOX versus active supportive care. But at that time when SWOG S1310 was being conducted, this was the first randomized study in the refractory setting. And the primary endpoint we were looking at wasn't overall survival. However, based on sort of the response rate that we saw in the prior studies of MEK inhibitor, there was an interim analysis built in that we were hoping that after enrolling 14 patients on each arm, that we would see at least one response in the arm of MEK inhibitor to go on to accrue a total of 40 patients in each arm. However, when the interim analysis was done, unfortunately, we did not see any response in the arm of MEK inhibitor. Therefore, we sort of shut down the study early. Therefore, the trial never got total of 80 patients. However, based on the number of patients that we had at that time, the response rate was actually higher in the arm of capecitabine, which is about 10%. And unfortunately, the PFS and overall survival favored the control arm of capecitabine or 5-FU compared to the MEK inhibitor Trametinib. So what we learned from this study was that obviously in a non-selected patient with advanced biliary tract tumor, MEK inhibitor really has a minimal activity. On the other hand, we saw some data that 5-FU or capecitabine alone may have some activity in second line as well. So unfortunately, even though the trial was negative, I think we learned a lot from the study, understanding that there must be a better biomarker to select those patients who may benefit from the MEK inhibitor. Unfortunately, due to lack of fund, we were not able to do any correlatives, which is an issue, but hopefully moving on, if you're going to use a MEK inhibitor in a biliary tract tumor, we probably have to find a better biomarker to select those patients out who may benefit from this drug.